Welcome to MedEnt Tutorials, an online educational platform which prepares you for your GMDC licensure exams for all medical, dental, and PA students, PLAB, CROC, nursing and midwifery exams, WASC, and many more. At MedEnt, you are guaranteed high-yield topic-based lessons, real exams MCQs, mocks and past questions, live reviews, exams hacks. Don't forget to hit the subscription button. Which bones form the sides and roof of the fetal skull? A. Frontal bones, B. Parietal bones, C. Occipital bone, or D. Temporal bones? The correct answer is B. Parietal bones. The parietal bones form the sides and the roof, vault, of the fetal skull. There are two parietal bones, one on each side, and they meet at the sagittal suture. Frontal bones form the forehead and the anterior part of the cranial vault. Occipital bone forms the back and base of the skull. Temporal bones form the lower sides of the skull, near the ears. So the parietal bones are responsible for forming most of the roof and lateral walls of the fetal skull. How many frontal bones are present in the fetal skull at birth? A. 1, B. 2, C. 3, D. 4. The correct answer is B. 2. At birth, the fetal skull has two frontal bones, separated by the metopic, or frontal, suture. These bones usually fuse into a single frontal bone by 6 to 8 years of age. This becomes true later in childhood, after fusion. 3/4, not anatomically correct for the frontal region. So at birth, the fetal skull consists of two separate frontal bones. Which suture separates the two parietal bones? A. Coronal, B. Metopic, C. Lambdoidal, D. Sagittal. The correct answer is D. Sagittal. The sagittal suture lies between the two parietal bones and separates them along the midline of the fetal skull. Coronal suture separates the frontal bones from the parietal bones. Lambdoid suture separates the parietal bones from the occipital bone. Metopic suture separates the two frontal bones. The coronal suture lies between which bones? A. Occipital and parietal, B. Frontal and parietal, C. Frontal and occipital, D. Temporal and parietal. The correct answer is B. Frontal and parietal. The coronal suture runs transversely across the top of the skull and separates the frontal bones from the parietal bones. Occipital and parietal is separated by the lambdoid suture. Frontal and occipital is not directly connected by a suture. Temporal and parietal is separated by the squamous suture. The lambdoid suture joins which bones? Parietal and frontal, parietal and temporal, parietal and occipital, frontal and occipital. Correct answer is C. Parietal and occipital. The lambdoid suture is a dense fibrous joint located at the back of the skull, forming the connection between the two parietal bones and the occipital bone. It has a lambda shape similar to the Greek letter lambda from which it gets its name. A. Parietal and frontal is joined by the coronal suture. B. Parietal and temporal is joined by the squamous suture. D. Frontal and occipital does not directly articulate via a named suture. Which fontanelle is diamond-shaped and closes around 18 months? A. Posterior fontanelle, B. Anterior fontanelle, C. Sphenoidal fontanelle, D. Mastoid fontanelle. Correct answer is B. Anterior fontanelle. The anterior fontanelle is the largest and diamond-shaped fontanelle. It is found at the junction of the frontal and parietal bones and typically closes by 18 months of age. A. Posterior fontanelle is triangular in shape and closes early by 6 to 8 weeks. C. Sphenoidal fontanelle, also called the anterior lateral fontanelle, closes around 3 months. D. Mastoid fontanelle, also known as the posterior lateral fontanelle, closes around 6 to 18 months, but not diamond-shaped. The posterior fontanelle is also known as A. Bregma, B. Lambda, C. Pterion, D. Asterion. The correct answer is B. Lambda. The posterior fontanelle is also called the lambda. It is the triangular soft spot located at the junction where the two parietal bones meet the occipital bone, corresponding to the lambdoid and sagittal sutures. Bregma is the anterior fontanelle, diamond-shaped, where coronal and sagittal sutures meet. Pterion is junction of frontal, parietal, temporal, and sphenoid bones, lateral aspect of skull. Asterion is junction of parietal, occipital, and mastoid parts of the temporal bone. Which part of the fetal skull is thick, ossified, and not easily compressible? A. Base, B. Vault, C. Face, D. Fontanelle. The correct answer is A. Base. The base of the fetal skull is the thickest and most ossified part. It is firm and not easily compressible, providing protection for vital structures such as the brainstem. Vault is thin and membranous, which is easily compressible during labor to allow molding. Face is the small and partly ossified region, but not the thickest region. Fontanelle is the soft, unossified membrane-covered gaps between bones. Therefore, the base of the fetal skull is the strongest and least compressible part. The vault of the fetal skull includes A. Thick base bones, B. Bones, sutures, and fontanelles, C. Only parietal bones, D. Only frontal and occipital bones. The correct answer is B. Bones, sutures, and fontanelles. The vault of the fetal skull forms the roof and sides of the skull. It consists of bones, such as frontal, parietal, and upper part of the occipital bones, sutures, such as coronal, sagittal, and lambdoid sutures, fontanelles, anterior or bregma, and posterior or lambda. These parts are thin, membranous, and compressible, allowing molding of the fetal head during childbirth. The fetal skull is flexible mainly because of A. Ossification centers, B. Presence of sutures and fontanelles, C. Small size of bones, D. Large brain cavities. The correct answer is B. Presence of sutures and fontanelles. The flexibility of the fetal skull comes from the sutures, fibrous joints, and fontanelles, soft membranous gaps. These allow molding during labor, overlapping of bones, and adaptation to the maternal pelvis. A. Ossification centers help bones form but do not increase flexibility. C. Small size of bones is not the main reason for flexibility. D. Large brain cavities is not related to skull flexibility. Sutures plus fontanelles equals flexibility. Which of the following bones is not of major obstetric importance? A. Frontal, B. Parietal, C. Occipital, D. ethmoid. The correct answer is D, ethmoid. In obstetrics, the bones of major importance during labor are the ones that form the vault of the fetal skull, because these influence molding, fetal head diameters, and passage through the birth canal. These include frontal bones, parietal bones, occipital bone. These determine key diameters, such as the biparietal diameter, occipitofrontal, suboccipitobregmatic, etc. The ethmoid bone is a small central bone located deep within the skull, between the orbits and nasal cavity, and does not influence labor mechanics, fetal head molding, or obstetric diameters. Therefore, ethmoid bone is not of major obstetric importance. Molding of the fetal skull during labor refers to A. Ossification of sutures, B. Overlapping of bones at sutures, C. Closure of fontanelles, D. Enlargement of cranial vault. The correct answer is B. Overlapping of bones at sutures. Molding is the process where the fetal skull bones overlap at the sutures and fontanelles during labor. This reduces the head diameter slightly and helps the baby pass through the birth canal. A. Ossification of sutures. This happens later in life, not during labor. C. Closure of fontanelles. This occurs months to years after birth. D. Enlargement of cranial vault. This is not a labor process. So molding equals overlapping bones, especially at the parietal bones. The clinical significance of fontanelles includes all except A. Assessing hydration, B. Assessing intracranial pressure, C. Determining fetal position in labor, D. Measuring skull base thickness. The correct answer is D. Measuring skull base thickness. Fontanelles have several important clinical uses. A. Assessing hydration. A sunken anterior fontanelle suggests dehydration. B. Assessing intracranial pressure. A bulging fontanelle may indicate raised intracranial pressure, for example, meningitis. C. Determining fetal position in labor. The shape and location of fontanelles, anterior versus posterior, help identify fetal head position during vaginal examination. But fontanelles are not used to measure skull base thickness. The skull base is thick, ossified, and not related to fontanelle assessment. Therefore, D is the correct exception. The bones of the fetal skull are joined by what type of joint? A. Synovial, B. Cartilaginous, C. Fibrous, D. Ball and socket. The correct answer is C. Fibrous. The bones of the fetal skull are joined by fibrous joints, specifically sutures between skull bones and fontanelles, membranous gaps. These fibrous joints allow flexibility, overlapping of bones, molding, and passage through the birth canal. Synovial is found in movable joints like the knee or shoulder. Cartilaginous is found in the spine or costochondral joints. Ball and socket is found in the shoulder, hip, not in the skull. Fetal skull equals fibrous joints for flexibility during labor. Thank you for watching. For more questions, visit medentweb.com. If you have not subscribed, kindly subscribe and follow us on our various socials.